Buoy Health Insights, hand pain. Hello, and welcome to another episode of Buoy Health Insights. Today's topic is one that affects many of us, hand pain. Let's dive into the specifics, potential causes, and when might be the right time to seek medical care. First, the hallmarks of hand pain. Have you ever felt discomfort when typing or struggled to pick up a glass? You might be grappling with hand pain. Hands are involved in almost every activity we do, and when they're hurting, even basic tasks can be challenging. Symptoms accompanying hand pain vary. You may experience a burning sensation, tingling or itching, stiffness, swelling, reduced strength, bruising or discoloration, misalignment of fingers. Each finger comprises a complex array of bones, joints, nerves, muscles, and ligaments. When any part of this intricate system suffers from stress or trauma, you feel it. Now let's talk about the potential causes of hand pain. Hand pain could come from a simple bruise, repetitive strain injuries like carpal tunnel syndrome, inflammatory conditions such as rheumatoid arthritis, systemic diseases like Dupuytren's contracture, or even tumors. Recognizing the cause is essential because it informs the treatment. For instance, autoimmune conditions like various forms of arthritis can lead to joint inflammation and are one of the primary reasons behind hand pain. Infectious arthritis, which could be caused by bacterial infections, also leads to joint issues in the hand. Metabolic diseases or thickened tissue and swollen tendons, as observed in Dupuytren's contracture, are more examples of what might be behind the pain. In cases like ulnar nerve entrapment or rheumatoid arthritis, the causes and symptoms can be more specific. Ulnar nerve entrapment typically presents numbness, tingling, and sometimes muscle weakness or wasting in the hand. For rheumatoid arthritis, look out for warm, swollen, stiff, and painful joints, particularly in the proximal joints of the fingers. Finally, a very common cause of hand pain is carpal tunnel syndrome. This is typically caused by overuse or repetitive use of the wrists. Pain associated with carpal tunnel syndrome is typically in the thumb, index, and middle fingers, and often associated with numbness or tingling. If you're managing minor hand pain, some at-home treatments might offer relief. These include immobilization with splints or braces, applying ice for 15 to 20 minutes several times a day. Resting your hands to allow healing, over-the-counter medications like NSAIDs or acetaminophen. Should symptoms persist, or if your condition is more severe, a healthcare provider may suggest prescription medications, physical therapy, or even surgery for issues like carpal tunnel syndrome. While hand pain might be common if you're experiencing hand weakness, numbness, or persistent pain, it's prudent to visit a medical professional. Early diagnosis and treatment can prevent further complications and help manage the pain effectively. Before we conclude, here's a friendly reminder. If you find these insights helpful, don't forget to like and subscribe. Your support allows us to keep bringing you valuable health information. Until next time, take care of your hands and yourself.